Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon, everyone. Sorry for the organizers and the speakers. I have to catch a flight at 2:30, so I think we are on time. I'll try to finish early. All right. Yeah, but I need to look here as well. Okay, I'll be standing here because I need to look at the screen. Okay, next. So basically, I'm a professor in nutrition, and my research with cancer started about 10 years ago, and it was with breast cancer patients. And then after that, we got invitation from the MRUN grant, which we applied together with UM and UKM to do a colon cancer study. So that's the journey of nutrition and cancer started about 10 years ago in my career. Next one. So I will not speak much on this. I think you've been seeing this in the plenary lecture as well. So I think breast cancer and lung and colon cancer are the three most common cancer in the world. Next one. And in the Asia, you can see lung and colorectal, and then breast and colorectal in the female are very much associated. And I found as a nutritionist that food has a lot to do with the colorectal cancer over to the other cancers that we can see on the slides. Mainly because this is the area where food come into direct contact with the surface of the gastrointestinal system, and there could be something that will trigger cancer from the food that we eat. Not like breast cancer, skin cancer, etc. This is not really directly connected to food. So it's very important for nutritionists, I think, to study more on colorectal cancer. Thank you. Next. Yeah, again, you can see breast cancer and colorectal cancer keep on coming as top two, and I think I'm focusing on the right cancers in terms of nutrition. Next one. So several studies actually has been done on colorectal cancer and diet, but most of the studies that we see in the literature, they focus on single nutrient. For example, vitamin C, vitamin D, protein, fiber. So these are single nutrient. And there are also some studies looking at food. For example, red meat. Okay, for example, confectionaries, etc. But in reality, we don't eat this food separately. We eat food as a meal. So because we eat food as a meal, it is important for us to study it as a meal, so that we can relate what kind of meal that we eat can affect, can trigger the development of the cancer cell. And dietary pattern is more preferred because it involves quantification, variation, or the combination of different food that we eat. And to do this, nutritionists are equipped with a tool which is called Food Frequency Questionnaire. So it's a questionnaire that we give to the patient. You can have a FFQ for pregnant woman, FFQ for diabetes. It can be for any disease. It can be FFQ for children, any age group, for adult, etc. But then it should be validated. And we do have a FFQ which is validated for cancer in general. But our team would like to redesign this tool so that it specifically caters for food that increases the risk of colon cancer specifically. So we work on that, developing the tool, validating, and doing reproducibility study, and then we try to see how it is connected to cancer. So the objective of the study that I'm going to present, there are two. First is related to the FFQ. Second is related to the prediction of cancer risk. Next. So this is where I will be flying to Kelantan at 2:30 p.m. today. This is where we are now. So this study is a multi-center. We collaborate with Dato' Raja Effendi from UKM. At that time, he was in UKM. So we collaborated with him. So the data collection, half was collected in Hospital UKM, half collected in Hospital USM. Previous slide. Okay. So it's a cross-sectional study for the phase 1 for the FFQ. And we have a good mix of urban and rural community in this kind of study. Next. So it's a long process to come up with an FFQ. It's a PhD, one PhD. This is one PhD. Basically, the student has to look at the FFQ from NHMS, which is for healthy people. And then we, based on literature, we design the FFQ. We add some food, we remove some food, and finally, we had 140 food items from several food groups. Food groups mean cereal, protein, fruit, vegetables. These are food groups. So we have about 142 food items. And that is part one. Part two is the part, we also provided food diary. Compared to food diary and FFQ, FFQ is based on recall. So it has weakness. So for example, you ask the patient, for the past 6 months, please mark the food that you eat from the list. But then food diary is more accurate because it is objectively written, meaning that the patient immediately write, hopefully, that what they eat, and they write down what they eat. So it is. So whenever we want to validate a tool, we must validate it with a superior tool. So in this case, food diary is superior to FFQ. Next. So this is an example of the FFQ. We have copyrighted, but it is freely available. Anyone interested to use this tool, you can contact me. I'll give my email at the end of the presentation. And you can see that it is like food like bobo nasi is porridge, white rice, nasi goreng, all those lists. It's actually got 142 items, very long list. And they just need to mention how many times they eat in a week or in a month, and then what is the serving size and how much is the serving that they had on that particular food. Once they completed this one, we can key in the data into a software called Nutritionist Pro. So this software has a database of food all over the world, and also including Malaysia. So it will calculate the amount of food that is being nutrient or food groups that has been taken by the particular person. So from there we can do further analysis. Next one. So the validation process happens that the first interview in FFQ1, first week of the study, and then we repeat again on the third week of the study to check the reproducibility, whether is it consistent from the way they presented in the first week compared to the third week. And then to validate it, we use that FFQ data, compare it with the food diary data. So if it's consistent, for example, someone is eating fried chicken 3 times per week in the food diary, similarly when we check in the FFQ, it is 3 times per week in the FFQ, that means there is a it's valid, it's consistent. Thank you. Next one. So this is the process, very long process, but in short, in terms of validity, we achieve between 62 to 75 based on the several statistical tests that is listed there. And in terms of reproducibility, it's up until 89%. Next. And if you are interested to read more about this paper, you can this research you can read from this journal. It's published in the Indonesian Journal of Nutrition and Food. Next, I move on to the case control study, where we compare non-cancer patient and cancer patient in terms of their dietary intake. So it's conducted in year 2022 at 2 sites. Next. So all patients attended the colonoscopy procedure were approached, and then they were screened according to the inclusion and exclusion criteria. So basically, this is the list of the inclusion and exclusion criteria. Next. And after the colonoscopy procedure, patients are divided into 2 groups. The cases were endoscopically and histopathologically confirmed CRC, diagnosed no more than 1 year before study enrollment. So it's considered new diagnosis. The control were patients with histological tubular adenoma, normal or benign. So basically they went through the colonoscopy, but they are not cancer patients. So these are 2 groups that we are able to get. And as usual, questionnaires on demography, health, dietary intake, and all other anthropometry are collected. Yes. And after going through all the procedures, we finally reached 264 patients, 79 cases, and 185 control. These are the final number included in the study. Even we excluded underreporter and overreporter. Underreporter and overreporter means that the food diary is implausible. The data is implausible. For example, they are eating too less or eating too much, unlogical. So we have a formula that we can calculate to remove them. So we have a clean data. Generally, socio-demographic cases were significantly older. They were Malay. They were from urban area, divorced or widow, and has a positive family history of CRC. Next. In terms of dietary pattern, so this is very complex statistical analysis. We call it exploratory factor analysis. I'm not going to explain that here, but from this factor analysis, we can divide the food into two types. So in the green box, can you go to the next one? The green box, which has a factor loading, a positive factor loading. The red box is negative factor loading. So there are four types of dietary pattern we are able to design from this study. The first one is the allergenic diet. So these are food consisting of condiments, egg, fish, and seafood. So these are grouped as allergenic diet. Next. The next group is plant-based diet, where, as you can know, fruit, vegetable, and even some bread jams are included through statistic as a plant-based diet. Next. The third group is the processed diet, mostly consisted of confectionaries, of local pastries and sweet desserts, and fast food. Fast food, as you know, burger, nuggets, donuts, etc. Burger, nuggets, sausages. Okay. Next. This is another group, we call it energy-dense diet, which consists of rice, cereal-based, noodle, alcohol drink. So you can see here we have 4. So from all these 4, we then move on to do the next analysis. The logistic linear regression to see which among all these 4 food is closely related to cancer risk. And when we control for age and energy intake, 2 food came up significant. First is the allergenic diet food, second is processed diet food. But when we control further in the model 2 for hereditary, family history, for age, sex, and etc., with more covariates, only processed diet pattern came out significant. The next one. So this is the table that shows you that the model 2 is only significant in the processed diet, meaning that processed diet is significantly associated with colorectal cancer risk. So other study, they normally group those as westernized diet. But in our study, we are not able to name it as westernized diet because it included our local cuisine. So for those who had curry puff just now, I'm sorry. You have few minutes to take it out, or you just read off. Inna lillah. But this is the news. So I was looking at the curry puff, I was saying, wow, very nice. But don't worry, a piece of curry puff will not trigger cancer. Okay, this is based on habitual diet. Habitual means the more frequent you indulge into those kind of diet, the more risk you will have. Okay. Next. So as I said, fast food and confectionery is very high risk. It's also reflected in other study, but it all depends which country you do the study. So let's say if you're doing in China, you may have a different way of categorizing the food. Middle East may have a different way of category because the type of food that is eaten there is not similar to the Malaysian food. And we all know the mechanism. There is a molecular mechanism involved where there is an oxidative stress, triggers to the gut surface that later triggers the development of cancer. And on top of that, we also found sugar as very prominent marker that is significant based on the confectionery. And the allergenic diet, when we saw allergenic diet, we were quite surprised to see fish and seafood, because based on our knowledge, fish and seafood is a white protein, less saturated fat, it should be healthy. But later, when we look at the food diary, we found out almost all of the patients are eating what? Fried fish. If you go to a Malaysian restaurant, it can be bawal goreng, tenggiri goreng, siakap goreng, whatever goreng. Most of the fish are fried. And in home as well, people prefer to fry the fish. So that is a contamination, probably from the fish nutrient with the oil that you are using. So, you know, a food can be healthy, can be unhealthy, depend how you prepare. If you prepare it with the wrong way, it becomes unhealthy. So in conclusion, the present study has identified 4 dietary patterns from 16 food groups in the Malaysian diet, including allergenic diet, plant-based diet, processed diet, and energy-dense diet. And among them, we have seen that processed diet showed a significant risk in colon cancer. And if you, the next one. And if you are interested to read more about the second part of the study, you can download these papers on open access in BMC Public Health. We were able to publish here. I think it's very proud for my PhD student who was very excited that we were able to be accepted here. And one thing that the author acknowledges was the local knowledge, because everybody knows processed food, Western diet is unhealthy, but when you have something more local, where you have a new knowledge highlighting the issue of our kueh confectionaries, that is something that added value to the research. And I would like to thank all of you for your patience and the organizer for giving me the way to present. And that's all for me. Thank you very much, everyone.
Thank you, Professor Dr. Hamid. Do you have time for questions?
Yeah, I'll take 1 or 2 questions if there are any
If
questions.
anybody has it, maybe I'll start, because you mentioned that we have ultra-processed food, processed food, sausages, etc., alcohol. I was wondering if you also included some of the food types that have already been good as good non-carcinogens, such as like Cantonese style salted fish, nitrogen-rich foods, things like that.
Yeah, we satay, yeah. So we didn't categorize that way. We categorize based on the food groups. That's why. So carcinogenic will come. Satay is one example, but satay comes as process. Comes as the method of preparation. So ayam, chicken is healthy, but once you grill it, or beef is healthy, better, but when you grill it, it becomes dangerous. Okay.
So how do you take that into account?
Which one? For this study, we focus on the food groups, dietary pattern. But if in terms of food preparation, it can be done, but we need to collect one more evidence where we ask them method of preparation. To do that, you have to do the food diary, because food diary is more detailed. So it tells you today this person had, let's say, nasi lemak with fried chicken, with how many peanuts and etc. Can be done, but we have to use the food diary.
Second precious question.
Did you pick colorectal cancer because you was expected to be more correlated to nutrition?
Yes, as I said in the beginning, among all the cancers that we know, I think the most closely related to food is the colorectal cancer. Yeah. Okay, thank you very much for your time. Sorry I have to